Okay, so let's go with our first case here. I'm a big Western movie fan, and I'm a visual kind of guy. My background is ultrasound and urodynamics, and I do video urodynamics. So when I see things, things always connect in my head. And being a Western fan, cowboys are always known for their six guns, but the Lariat or the Lasso is also a very integral part of a cowboy's life. And you're saying, what does this have to do with anything? Well, I just wanted to let you keep that in the back of your mind as I go through this talk, okay? So let's talk about the patient. It's an 11-year-old healthy boy. There's no history of any type of urologic complaints, evaluations, or interventions. He was potty trained at 3 to 4 years of age without any difficulty. He has intermittent nocturnal enuresis, 1 to 2 episodes per week, and has gone 4 weeks without an episode. He has ADHD, which is attention deficit hyperactivity disorder. So he comes to our radiology practice or urology practice as a consult from the pediatrician. So he has another episode of dysuria and hematuria, and he was seen by the pediatrician on July 31st. And they ordered a urine culture, and the culture was positive for Staphylococcus aureus, and he's treated with oral antibiotics with rapid resolution of the symptoms. So he comes to us and on August 19th, and that was 18 days after the initial culture that was positive. And at this time, he has no present complaints and no physical anomalies. And his routine urinalysis dip that we did in the office that day, he has leukocytes, nitrates, protein, occult blood. So they ordered an ultrasound on him. We did a bladder ultrasound. So you can see, initially you can see those two curved arrows. There's definite wall thickening within the bladder. And on the next slide that you see with this arrow pointing, went the wrong way. There's something within the bladder there. Some more images as we're doing longitudinal slices through. It's continuous within the bladder. And it looks like it's kind of coiling within the bladder and has this rounded appearance to it. And that's a sagittal image and a transverse image. And if you know anything about ultrasound, one image is 90 degrees from the other. So the radiologist who reads our films made it a differential diagnosis. It was either ureterocele or foreign body. So a ureterocele, if you're familiar with what they are, that's a cyst within a cyst. That's what it looks like on an ultrasound. And it's a cyst within a cyst within the bladder. There's usually a concurrent UTI, which is very typically present in children that we find them. But what was atypical about this is that it wasn't simple. What we call it a simple cyst, it's one circle. But if you saw those images, it looked like there were several circles within it. And this particular object was midline. And they're more commonly seen on either side of the bladder. So the foreign body, if it was a foreign body, it had a curvilinear coil density is what we would call it. It also had a current UTI, which was probably because if it was a foreign body, it was introduced without, of course, any sort of sterile technique. And this little boy had no symptoms or complaints. However, we see the thickened wall, and obviously dysuria has to be present because he's had this foreign object for quite some time. So obviously because of fear and denial. So this is what a ureterocele looks like on the one side, and this is what our case study looks like on the other side. So somewhat similar, but again, it's not the same. So they ordered a cystogram on this little guy, and as you can see on this, it's right in the midline. The other image isn't so good, but it's pretty large.